When patients come in for a veneer consultation, we discuss three things: why, what, and how. Why involves usually discolored teeth, misshapen teeth, crowded teeth, something about their smile that they just don't like. Then we talk about what. What is needed usually are porcelain veneers, which go over the front of the teeth and allow the tooth to have a brighter, more natural shape, and it fits within their smile much more naturally. How involves the procedure itself, using anesthesia, sometimes nitrous oxide to relax the patient even more, and we reduce the front of the tooth that allows the porcelain veneer to fit very flush and very naturally on the front of the tooth, and it's bonded in place. Now, before we bond the final, we need to make an impression. The impression goes to the lab, and/or we can use our in-office veneer making machine called the CEREC, and we have the patient go home with temporaries, or provisionals we call them, that go over, and their natural smile is transformed that very visit. They go home, they test drive them, we call it, and then they come back a week later, and the patient tells us if there are any changes, any brightness changes, they want to go brighter or it's too bright, and it allows them to test drive it, and they feel really comfortable before making that final commitment to the porcelain ones. We make an impression once the patient gives us the thumbs up, and we send that back to the lab. That allows the lab to then know the length and the angle, everything about the veneer that will help them to make the beautiful porcelain artistry that they can do. Then, about 3 weeks later, we have the patient come back, and a little more anesthesia, very comfortable, and we place those and bond those porcelain veneers in place. And patients ask us a lot of times, are veneers painful? And the direct answer to that question is no, especially with the technique and the materials that we use nowadays. Going through the temporary phase where there's a test run really only involves taking a little bit of Tylenol or Advil, and other than that, being careful those first few days with what they eat and drink. But really the procedure is amazing, and we have most patients come back just really excited about how comfortable they are.